movement selection is load management. Like if I give somebody a bilateral hip hinge and like low back starts tweaking a little bit, they're like, 4 weeks into this, they're not really liking it. You give somebody a kickstand, B stance, dumbbell, RDL. All of a sudden, like the load is managed. They're not lifting as much. They're probably gonna light up their glutes. And although it's not better or worse than a loaded barbell RDL or a barbell deadlift, it's a way that we can select a movement to manage load and then have them still achieve the minimum amount to elicit maximum amount. So always trying to find like exercise order in a training session and then selecting the appropriate movements that is the most efficient for that person without doing too much, but still stimulating what you need to. So like trying to walk that line is corrective exercise.
The Fitness Movement is brought to you by Zor Fitness. We offer coaching and individualized program design, as well as educational content for coaches and athletes. It's all one place, zorfitness.com.
Perfect amount of leg room.
Just like an airplane.
Yeah, right. Except nobody's kicking me from the back, so.
Oh, gosh. Literally every time I ride an airplane, I'm like, how do people who are massive do this? It's like you'd have to buy a first class ticket.
You have to buy a first class ticket, yeah. I mean, or buy 2 seats. But
yeah.
One time I went to Portugal and it was like an 8-hour flight. 2 people right next to me didn't show up, so I got the whole aisle.
Yeah, so
there was an overnight flight, and yeah, it's pretty sick. Yeah. Laid out flat, slept for like 4 hours. It's pretty good. Never had that luck again, but it's solid.
Yeah, man. When we release this, it'll be all squared away that you'll officially be here, and we'll be able to announce it and have crossed all our T's and dotted all our I's.
Cool.
So, yeah, I mean, this has been a bit of a slow, like, official announcement, but we're excited to, like, have you on board and be, I don't even want to say on board because it's not like you are working for our business, but, like, we can explain the structure, but basically, like, T3 is just kind of operating out of our building, essentially.
Yeah.
So take it away. Like, what's your business? Who are you? I guess like let's start with like your credentials, and then we'll like back up into your story a bit.
Cool. First things first, this is my first podcast, so like if things don't go well, we can cut the whole thing and try again.
No, it's magic of editing. It'll be
That's
fine.
That's true.
Yeah.
So yeah, you said start with the structure or start with like how I structure my business?
Let's start with like. Yeah, like you're a doctor of physical therapy. Just kind of like explain like what that entailed to get to this point, and then like what your business is now.
Yeah, I always find like the question with like why did you choose your major, your career, as like kind of funny because like as a 16-year-old junior in high school,
yeah,
like did I really know? No, like mom gave me like 5 or 6 suggestions, and it's like choose one of these. What do you think?
Yeah.
PT came along with some sports in my mind on paper. AT pays a little bit less, athletic training. So it's like, all right, PT. So it's like a big decision as like a junior in high school.
Yeah.
But yeah, I mean, here we are, 6.5 years of school and a lot of student loans later. But like super happy to be a PT and passionate about the career, which is cool. Luckily. Yeah.
I was just gonna say, would you have gone to PT school again knowing like what you do now?
Yeah, so yes, for sure.
Okay.
The path that like I'm kind of going down is still a little, it's still kind of new. So like the traditional path is to get into a clinic, maybe get into a hospital system and go down that path and maybe be a little bit underpaid for what you're worth and with a lot of student loans. And so like if that was the path I was going down, maybe not, to be honest.
Yeah.
But there's a lot of opportunity, which is fantastic. That's a huge pro for the PT profession, which has allowed me to kind of go down and create this path for myself, which absolutely would do it again. So, and I'm not even like, we're just starting out, but like would do again.
Yeah. I feel like, I mean, did you have any like business, like how to market yourself, like any of that stuff? Zero. Yeah.
Zero.
So like I went to school for health and physical education, so obviously I got none of that because like, but I even think people who are like in applied health sciences, which was sort of like, we had a lot of like crossover classes. I don't think they really had any of that either, which is like, it's like a huge deal. Like you need that. I mean, obviously like teaching is different,
right?
Which I thought I was going to be doing, but
I think I had like a marketing 101 my freshman year of college in undergrad. I don't even remember anything from it. Like the 4 Ps of marketing or something like that. Like I can't even, like price might be one of them.
Yeah, price. Okay.
Price.
Got one.
Price, production, maybe. I don't know. But yeah, like to your point, no, marketing is not there.
Yeah.
That's for sure. And I'm still figuring that out.
Yeah. But that was kind of like my point with that was like, but now like we're both running our own businesses and it's like, I mean, yeah, I'm sure like a fair amount of PTs at least. It's like, you know, if you're going to open your own clinic or something, that's like a very big part of it. Like, okay, obviously you could hire somebody to do that, but if you're going to take on, like, especially if you're starting off, you're probably going to take on a lot of that stuff yourself. So it's like, it's an important part of it. So it's interesting in that, like, you know, if you're a physician or something, like typically you're going to go into a system where like you're able to just kind of execute on like what you've been taught to do up to that point, where it's like somebody like yourself, if you're going to take like more of an atraditional route, it's like you have to, it's obviously you spent the time that you were in school, then you have to spend additional time to like kind of build up your, I mean, I guess everybody does this, right? But it's like, it's a little different when it's like your own business, because it's like you have to build up your clientele base and like trust within the community, and like all that process is just like, it's like additional probably years that like I feel like most people aren't accounting for.
Absolutely. And it's, you know, although this is kind of a couple year new path for PTs, like the, you know, direct pay and performance coaching route, I'm not reinventing the wheel. So like there have been people, a lot of really, really good PTs that I like look up to and that I've seen them be successful in this route. So like there's a lot of examples that I can look to that I actually have like direct communication with, thankful to social media, to be honest, to see how they navigate business and see how they navigate marketing relative to what I'm trying to do, which is cool. And I'm sure you can attest to the same thing, right? Like I'm sure you have people that have 10, 15, 20 years into the career, although CrossFit's what, like 20 years old? Is it even 20?
Yeah. It's probably 20 at this point.
20?
Probably 20 to 22. But like obviously that was one of the starting outs, like most people didn't know it.
Yeah. So I mean, almost in your situation, you're probably moving into like that frontier of being a CrossFit entrepreneur, right? Like it's only a 20-year profession, so it's not that old. So
no, not at all. Even the idea of like, I wouldn't necessarily call ourselves like a micro gym, right? But the idea that like you're not a chain, you're not a franchise, so it's like you're not having like all these materials handed to you. Like the idea of like an independent gym that is more of like functional fitness type space, right? It's like that model is relatively new, I think, versus, you know, like Gold's Gym, Planet Fitness, like those, you know, the big commercial gym feel is just like a very different business model, and it hasn't been around that long. 100%.
I mean, you walk into this gym and the first thing you notice is how almost before you start to look around how empty it looks, right? Because like you just have a massive
it's big open space,
right? So like you're telling me there's no like pec deck lying around kind of thing, you know?
Dang.
Yeah,
We
right.
could really use that.
Push-ups don't cut it. But yeah, so it's cool for this area to have something like that. So yeah, respect. Yeah, and I think, you know, going back to why direct pay, why start this business. I think it was like my third clinical rotation. I was like out in Cincinnati, kind of by myself. And so I just used the time to like do a lot of research and like listen to podcasts more than I probably should. And I found a couple guys and women that started a cash-based PT business. And I'm like, this sounds amazing. And I guess the idea is like, you have to provide somebody enough value that they're willing to invest back into their health and back into their life. But if you continue to learn and find that value that you can provide somebody, like it's a win-win for the client and the therapist. So yeah, still navigating that, but figuring out how to do it has been a lot of fun. So
Yeah. So like take us through like what are some like the facets of your business and like what do you do for most people?
Yeah. So 2 legs. I have.
What is your business first of all? You can like say the name of it,
That's a
all
great
that
point. T3 Rehab and Performance. It's a physical therapy and performance coaching business. So 2 legs, literally physical therapy, performance coaching. So those who are the ideal client population for somebody who is like a physical therapy leg side of the business would be highly active, whether it be a trail runner, marathon runner, weekend warrior, lifter, athlete, somebody who's trying to scale back to a high level of activity, likely with some skin in the game, whatever that looks like. Yeah. And, there's a gap there. They're injured and they need a little bit of guidance on how to bridge that gap. And so that's where the physical therapy side comes in. And then performance coaching, athletes, gen pop, those who are looking to maintain longevity and quality body composition and general health markers. Yeah, they fit into the performance coaching leg of the business where we work weekly, whether it be in person or remote, to make sure that we're staying on track with everything fitness related.
Yeah. Yeah, I feel like a lot of athletes, I think they trust physical therapists, but I think also there's like a hesitancy sometimes to go see somebody because it's almost for the same reason like an athlete might be just slightly dishonest with me, like when I'm coaching them, like in terms of like feedback that they might give me, like, I have this little naggy thing that's going on, not that big of a deal. Like I don't need to put in the feedback where it's like maybe just a little bit of like fear of like, they're going to take away my training or they're not going to let me do this. Or it's like, and I think a lot of people have at least a little bit of that when they approach physical therapy. I think, again, like physical therapy, I think in general is like a very well-respected profession and people get it and it's been around a long time. But there's also that like little bit of hesitation of like, oh, if I go to them, are they going to tell me I can't lift anymore?
It's a rightful hesitancy.
Yeah.
Honestly. Because like, I trust more personal trainers and more coaches than I do with physical therapists when it comes to scaling back somebody at a high level.
It's so hard though, because like I also see the other side of it. Like like for everybody that like you have somebody who is like a cerebral athlete who is trying to get back to performance, you have 20 people who think they know something and they know nothing. Or like what they actually know is like just being harmful. So it's like,
well, the barrier to entry for personal trainers is so low, right?
Yeah.
Like, doesn't weed out a whole lot of the bad apples. But
I guess what I was saying, like referring to like, okay, if I'm a physical therapist and I recommend someone, like, how about you don't lift, right? Yeah. The chances are, if they're lifting with perfect form on a spectrum down to poor form, they're probably on the poor form end of it, right?
Yeah.
So it's like,
I see what you're saying. Yeah.
It's almost like, I totally understand why the majority of physical therapists are like, hey, maybe don't do CrossFit in your rehab, because it's like, who knows like what they're actually getting coached through, how they're actually moving when they're actually in there. So it's like, I also see the other side of it, and it's like I understand that like a lot of people probably should pull back a little bit more if they're not moving well.
Yeah, I mean there's definitely a line there to walk.
Yeah.
And I don't always blame the therapist that is always no, don't do that, that's a red flag type therapist, because that's the way that like PT school and studying for the boards and becoming an entry level PT, that's the route you go, is like, don't kill anybody and practice safely, right? And so like that's how you graduate. And a lot of the physical therapy profession, especially like the old guard, like the old way PT was, that's changing, but is there's always something mechanically wrong in the body, and we need to find like the solution to that mechanical problem. So like if somebody presents to me with back pain and they're like doing CrossFit heavy, and I'm like, well, you're doing a ton of extension in the back, to arching the back constantly with like kipping pull-ups, like we got to cross that off. Because the old guard says that there's a mechanical issue and you're having pain into extension, kipping pull-ups put you into extension, cross it off, red light it.
Yeah. Which, by the way, probably isn't a bad thing a good chunk of the time.
Right. Yes. Yeah, you're right. You're right. And especially it comes down to the person in front of you. Yeah. Like CrossFit athletes love to push the needle, love to move the needle, like to push tolerance, right? And that's a good thing. Yeah. But when it comes to pain, there are some constraints that need to be put on rehab. But I think when I see somebody in front of me who I do need to put constraints on their training, the goal is as soon as we can to lift those constraints. Yeah. And get them back to where they need to be. And
right.
So
that's why they came to you in the first place, probably.
Yeah, exactly. And that's where traditional like physical therapy in the clinic, insurance-based model fails, is because the end goal is to get you out of pain. That's it, right? But it's never to scale back to the level, whatever your goals are. It's never you never can scale back to that. Number one, because insurance companies won't reimburse the therapist. They'll be like, you got that person out of pain. Why would we continue paying you for them to come into the clinic?
Right.
And there's a lack of strength and conditioning principles in the general physical therapist population. So the ability to help somebody scale back is not always there either. So
yeah. So my interpretation of what you're saying is sort of like there's this gap between like what insurance would be willing to bring you back to what most people, if they're active, would actually like to get back to function.
100%.
So it's like, hey, you're cleared. Great. Which is like, for most people who are in like athlete mode, it's like, now is when I can actually start. But like starting is like very different than like full participation back to like whatever their best version was. So there's like, there needs to be somebody who do things like you do that have that basically can bridge the gap between like, you know, well, you can take somebody from square one up to being cleared essentially, but then there's also that process of taking them from being like quote unquote cleared to like actually up to full function again.
Yeah, let's finish the job, right?
Right.
You know, shout out Jordan Shallow. I don't know if you know who that is, but he's a chiro, works with a lot of sports PTs or sports like elite athletes. He one time said this equation that like literally sticks in my head whenever I approach any type of like situation is so injury equals applied force greater than tissue tolerance. So like a paper cut, when I slice my skin, the applied force of the paper greater than tissue tolerance that was able to handle. Same thing with back pain, knee pain, you name it. And so traditional PT is like applied force. We take that away. We put constraints on what you're doing. We let things calm down. Job done, right? But like, did you fill the tissue tolerance bucket? It's like maybe a little bit, but not enough to scale back to that activity, especially because you took time off and put constraints on what they were doing. So applied force, handled, managed, but did you increase tissue tolerance? No. So then chances are that person is going to eventually get injured again or hurt themselves again because they're going to find themselves in the same situation. So making sure that like, we oftentimes need to put boundaries around applied force. But at the same time, like, you got to improve your tissue tolerance, right? Like you got to make sure that like if it's the back that keeps getting injured, like we find ways to challenge and improve the back. Do the most challenging thing that you can do well, even in the context of rehab, even in the context of exercising through pain. It's like, how can we scale to the most challenging thing you can do well so we actually stimulate an adaptation, so we actually make change in the body, which is really what like the basics of strength and conditioning. But it's just putting it into pain. That's it. Like that's the way I practice. It's pretty simple. It's pretty basic, but like the principles are the principles are few and the methods are many, right? So like just making sure that I stick to the principles. You can get creative with the methods, but yeah.
So like for your performance coaching people, and this might vary. So maybe it's a bit of it depends, but like how much are you adding like prehab type exercises that might be, again, it's not like this, right? Where it's like, oh, these are physical therapy exercises and these are like strength conditioning exercises.
It's like that a lot, unfortunately.
Yes, but like that's probably an easy way for people to think about it, right? Yeah. So it's like, how much are people getting like prehab type things? So essentially like rehab things, but like not being injured. As like more preventative type stuff. How much are like your performance coaching people getting that kind of thing? What's your opinion on that as a whole?
Yeah, right. Question. I mean, I don't like the term corrective exercise, right? Like, it gets thrown a lot, but I think it's kind of remedial. It takes something and puts it like, oh, you're doing this just to like prevent pain, which you can't prevent pain or injury, it's inevitable. But usually corrective exercises, prehab exercises are these like low intensity movements that don't actually really like create adaptation in the body. So not that it's junk volume, not that it's a waste of time, but is it? Like, I don't know, kind of, right? So like if the goal is injury risk management, like prehab, you could say.
Yeah.
I think the idea is to find ways to integrate that into the meat and potatoes of the workout, of the programming. And so like there are three, if zooming into a specific workout day, I feel like there are three opportunities to get some prehab, to get some like good movement variability into somebody's training. And it's the warm up, it's the setup for the main exercises, and it's the accessories. So rather than spending extra time, 25 minutes on mobility, doing 85 bird dogs until your middle name is bird dog, right? Like finding out how to integrate like prehab, or exercising appropriately, programming appropriately, moving in a variable way into the workout itself is a way better for efficiency of time. Nobody has time to do corrective exercises 8 times a week, right?
Yeah.
So, yeah.
Yeah. And this is something like personally I've gone back and forth on, right? Because I have people that I do like individual design with remotely or here. And for especially for like my competitive CrossFit athletes, right? They're getting so much of like certain patterns because like that's what's necessary to like improve the things that they need to improve to close the performance gap to like basically continue to work on their weaknesses. And it's like, if they're basically required to do 300 moderate to heavy hinging reps in a week or something, right? It's like, okay, that's the reality, right? And if we just add a bunch of extra stuff in, that's probably not helpful in terms of like just adding to their total fatigue and workload and more time in the gym and all that stuff. But at the same time, there are probably things that it's like, okay, if you're doing this bilateral hinging constantly, like what things could potentially come up. And as you work with an athlete longer, then there's like, okay, we know that if I have you do, more than 3 times a week of heavy squatting, it's like if I asked you to do some squatting and conditioning setting and along with that, okay, you're probably going to start to run into some anterior knee irritation. Maybe we give you a little extra like hamstring stuff that like helps your knees feel better, which again, it could be like that prehab stuff, but then it's also like, it's not just like this shotgun approach of like general, because it's like, we know this specific athlete has this one thing that they're dealing with. And we know that like these general types of exercises could because of our experience with them, it's like that can help mitigate some of that irritation that they might get, or potentially like, and just keeping them a little bit more balanced, where it's like, if you're always in the exact same pattern, you're going to have to get overused, right? So it's like, it's no different than like, okay, maybe a runner could do some more, time under tension based things in the hamstrings, because they're getting a lot of hamstring, but it's not in a setting that's gonna encourage like muscle mass to basically stick around, right?
What stimulation are you looking
for? Right. So it's almost like, I think there is, like you're saying, there's probably some of that is probably worthwhile, but also like if you just add it in because you're like, okay, we need to do joint health, so let's just add all these different things and just try to do that. It's like you're just like kind of wasting the person's time and resources almost.
Absolutely. I mean, you said it, like bake it into their programming. And if you're going to give them a hamstring exercise because they've been doing 18 bilateral squat sets a week, it's like, great, but make that hamstring exercise still worth an adaptation, right? Like still make it worth their time, which is where it comes down to, which is no longer like corrective exercise. It's like, it's just an adaptation you're seeking, and which is great, and that's how it should be.
Yeah, that's such a good point too, because like again, also I'm having to relate this to myself because that's all I can do. But it's like my shoulders were just very intolerant of internal rotation, like loaded, And I was like, well, this probably isn't just great generally. So it's like, okay, let's try to build up some tolerance. So it was like doing some like, dumbbell extra rotations. And it was like, initially like 5 pounds was like all I could do. And it's like, now if I did that for sets of 30, it would be like not really worth my while. So it's like, if you don't progress it somehow, also it's like one of those things like, especially if you're keeping it in constantly, like I know so many people, it's like they have to do I'll just pick on like crossover symmetry or something. And that's bad. But like, okay, I have to do this to keep my shoulders healthy because that's what this person told me.
Or I do bird dogs before every session because bird dogs are supposed to help with core stability, right? It's like, cool, like bird dog might be the movement for you to start, but like, did you scale it? Like, are you like a year from now, are you still doing 3 sets of 10 bird dogs before your workout? Like, unless like mentally you feel like you need that to get ready. Which I think most of the time that's what it is. It's like probably a little bit of it was like, maybe it was like a legitimate thing in the past. And now it's like the athlete just kind of keeps doing it forever. Because it's kind of like I don't want to say mental crutch, but essentially that's what it is. Yeah, absolutely. And I think the biggest tool that you can use for corrective exercise is not even a single exercise. It's just load management and making sure that you have movement variability in your programming. So like you said, like if you're just doing a bunch of bilateral hinges, but that's how it should, like that's what needs to happen to trend towards the goal you're after. Programming in a way that like, that applied force is going to be there week after week, and that's okay, that's established. But making sure like you get some maybe unilateral, their single leg work in, whether it be like a hinge, whether it be some hip airplanes, like whatever it needs to be to make sure that like you're accessing different positions of the body in a way that still creates an adaptation to combat or to at least mitigate the applied force of like the barbell deadlifts every single week, right? So movement variability and then overall load management of the program is the best corrective exercise that you can possibly do for somebody and for your own training. So going back to what you said about like people are hesitant to go to a physical therapist because it's always red light this, say no to that, like take training away. And then you say the word, like I say the word load management, and that sounds like I'm always putting boundaries on or I'm taking things away, right? But like load management definitely does not have to be that. It's just figuring out like what movements to put in, what movements to take out, seeking the minimum amount of training that still elicits like the maximum amount of benefit from it. Anything more than that is just junk volume, right? Like even for you or Usain Bolt or anybody.
Wow,
right?
I never thought I'd be in the same sentence with Usain Bolt.
Right. Ben Wise, Usain Bolt, Trent Woolcock.
So Coach Day, people who are listening to this will know who I'm talking about. She works with me with Zor. She always is talking about load management, and she's not a physical therapist, she's a coach. So it's like, but like that's constantly something that she's thinking about and talking about because like it's so important as like a coach because like that's one of your primary jobs as someone who's in a capacity-based sport. If you're just like doing some sort of energy systems training, like as in a racing sport, it's like you're basically trying to, in an indirect way, like obviously you're trying to push up performance, but essentially you're trying to maximize the amount of productive training like volume that someone can get in, especially during certain times of the year. And it's like that all comes down to load management. Like you're trying to just push that person as far as you can, but then you have to pay attention to certain feedback markers and the recovery status and things like that, where it's like if you're pushing someone that hard, you just have to be a little bit more aware of where you're moving. And it's no different than something like an injury too, or someone's coming back. Yeah, absolutely. And movement selection is load management. Like if I give somebody a bilateral hip hinge and like low back starts tweaking a little bit, they're like, 4 weeks into this, they're not really liking it. You give somebody a kickstand, B stance, dumbbell RDL. All of a sudden, like the load is managed. They're not lifting as much. They're probably going to light up their glutes. And although it's not better or worse than a loaded barbell RDL or a barbell deadlift, it's a way that we can select a movement to manage load and then have them still achieve the minimum amount to elicit maximum amount. So,
always trying to find like exercise order in a training session, and then selecting the appropriate movements that is the most efficient for that person without doing too much, but still stimulating what you need to. So like trying to walk that line is corrective exercise. Absolutely.
Yeah. I guess one of the things that like I feel like I'm excited about to have you here is like, and we've talked about this, and that's the reason you're here, is that like I feel like our businesses will be able to benefit from each other and help each other grow, which is obviously what we're both excited about. It's like, you know, inevitably as people are like training hard, as like people here train hard, like that's
as
the reality.
they should,
right? And it's like nothing against other places, but like reality is like a lot of people go to a gym and they don't work that hard.
No.
Whereas like people here, like generally they work very hard. It's
They be
like,
working hard, man.
It's like the exception that we see people and they're like not giving like their true best.
Yeah.
So it's like when that's the case, like yeah, people are going to deal with stuff sometimes, and that's the reality. So it's like, obviously when that happens, we can send people to you, and that keeps them in our walls, and then also like allows them to return back as quickly as possible to like what they want to do, which is kind of what we were getting at before. So I feel like I hope it's like a beneficial relationship for both of us.
Yeah, absolutely. And I'm super excited for that. Touching on that, like sustainability and performance, it's a spectrum. And if you're not training for performance, what are you really doing, right? Like, are you training for sustainability? I would say maybe not even that, because training for performance is kind of training for sustainability, right? Like if you're, the people here train for performance, and that is one of the main reasons why they are consistent in their training, because they see the results and they continue to put a high degree of effort in, and that keeps them in a sustainable training program, because it's a feedback loop, right? So they're not equal, but at the same time, like training for performance is a sustainable way to train. And so making sure that like they continue doing that even when injuries or aches and pains show up is huge, because like we don't drop down sustainable, right? Like no, we keep pushing performance. We find some things that like, okay, maybe your knee, like we can't squat right now. We can't go into deep knee bend. Like, okay, that's cool. That's a red light. Let's work towards making it a green light. But that doesn't mean like we don't keep pushing the needle and keep moving hard, right? So I'm not taking you to the mat table, right? just because you have knee pain. Like, nah, let's get you on the gym floor. Let's still work. Let's put in that effort, and let's not drop any of the physical qualities that you've just achieved, right? So like you talked about energy systems. Like we got to make sure your aerobic capacity stays up. We got to make sure that like we're filling strength bucket, we're filling power bucket. Like that's not going away just because you're injured. So
So Alicia, who was she's also a doctor of physical therapy, was I forget how long she was here, like maybe 18 months.
Okay.
But she moved back home, and one of the things that we talked all the time, but one of the things that I remember she talked about was like, there's like almost never a time, and this obviously I can relate to a lot, but there's like almost never a time where it's like every part of your body when you're training hard feels like good to go, right? Yeah. There's usually something to some degree, it feels a little bit off, and you're always constantly managing that. And it's like, I think obviously she's somebody who people who know her, she's really fit, she works hard, she's diligent, she moves well, like all those things. So it's like, you see somebody like that they're highly educated, they understand what's going on, and they're dealing with things that pop up frequently. It's like, I think that should be like a lesson to people of like, okay, this is someone who knows what they're doing, they understand how they should be moving, they move well, and they're still dealing with things because they're pushing their boundaries. And it's like
100%.
Everybody's going to be in that boat where it's like, if you're pushing yourself hard, there's going to be things that come up, and the people that stick around are the people that understand like, just because like I'm not going to squat below parallel today doesn't mean that I shouldn't come in and get some good work in.
Yeah, absolutely. And that brings 2 points to mind. Is like, number one, like you can maintain your gains and your progress with like, I think the research says like 1/9 of your current training volume for like 3 to 4 weeks, right? So like if you squat below parallel for a few weeks, like you're chilling, like you're not even, it might even be a novel
people
stimulus,
often
right?
like feel like they're going to regress so much faster than they actually do. It's
absolutely.
like
Absolutely.
they took away, they couldn't do the workout as prescribed because, you know, they couldn't do, you know, whatever. Yeah.
Right.
They couldn't press overhead today. And it's like the world's falling in. It's
world's
like,
falling in.
It'll be okay.
Yeah. And the reality is like most musculoskeletal pain tends to just take care of itself as long as we're training appropriately, eating like an adult, like sleeping like an adult, right? Like doing certain things that the body needs to heal, like the injury, the pain, it's probably going to work itself out in 6 months, right? Give or take, of course. But, which, yeah, just speaking on like continuing to train at a high level and not letting those, not letting energy systems or like the physical quality buckets that you've built empty just because you're in an injury, because it's probably going to take care of itself in a few months if it, you know what I mean? So, yeah.
Yeah, I also think like, as I'm thinking about people like rehabbing, like I think one of the challenges is like a lot of people either default if they're, you know, not working with somebody like you who maybe is looking at outside factors as well, whereas like, again, say they go to, you know, physical therapist and they're getting like, they're working on this specific joint or whatever, and it's like oftentimes what's going on outside of that isn't accounted for a whole lot, and like oftentimes people aren't super good about like either maintaining the like maintenance, like, oh, what a terrible word, like nobody wants to do that, right? But like the reality is like, okay, if you can't push that hard, that's your option at best, right? If you're not regressing. So it's like being able to reallocate resources and like, again, I think what most people do is they either like, again, either try to push something forward that is like, okay, I injured my shoulder. Okay, I'm gonna squat every day of the week, and all of a sudden they're dealing with something else. Yeah. Or like, you know what, I injured my shoulder, I'm gonna turn into like a blob for the next however many months until I'm back to function. Yeah. I'm sure you see that all the time.
All the time, dude. And I don't know if you've seen a chart. It's like a pain chart. It's more of like a Venn diagram, but like it has a ton of different bubbles off of it. And it's like it's demonstrating the multifactorial nature of like pain and injury. And it's like I touched on mechanical issues earlier, and it's like that's one small bubble off in like the corner. And then like you got the big rocks where it's like sleep management, nutrition management, stress management in life, familial history, like all of these things that are the big rocks when it comes to injury and pain, and making sure that like those are in order before we think about like a wall sit for knee pain. It's like what's a wall sit gonna do? What's like some passive range of motion gonna do if you're sleeping 4 hours a night, right? Like it's like trying to dig a shovel with a spoon, or dig a hole with a spoon, right? Like it's not gonna happen. So zooming out, looking at the bigger picture, which is something often like insurance companies wouldn't reimburse for, or like I don't have the time to do because I got somebody else walking in the door in 30 minutes in the middle of our treatment session. So talking about like nutrition strategies, talking about like sleep management strategies, stress management strategies, in addition to your training program, your exercise selection, is really where the value comes in, stepping outside of the insurance realm. Yeah, so big rocks, man, big rocks, they matter.
Yeah, and that's the hard thing, and I think a lot of doctors are in the same boat, where it's like, do I take the time that I don't have to explain to this person who doesn't care about what their habits should be? Exactly. Or should I write them a prescription?
Yep, which is cool because like the people that come to work with me, they do care. So they want, and I have the time, right? So like that completely weeds out anybody who's like, I just want an MRI for my shoulder, dude. Like write me off like sign the evaluation, send it to the doc, right? Yeah. So to your point, like the way the business is structured, nobody that is coming to me is looking for a quick fix. Like they understand before even stepping into like having the first conversation, like what this is about, what the work entails, like meeting me halfway, and like, so that's cool.
Yeah, I think, I mean, obviously, like you were saying, like injuries are just so multifactorial in so many ways. And I guess the last thing that maybe I had thought of that we could talk about was like some of like the mental side of, emotional side of like rehab as well. And if like you address that at all and like the people you work with, because like I think like for myself, like I tore my ACL in high school and had a reconstruction, and it was like,
I didn't know that.
yeah, so I like like that was really my, besides like maybe a pulled muscle that was like, you know, grade 2 at best or something, right? Like not severe. So it's like, and then to like have like a 6-month rehab process and a surgery and all that stuff was like the first time I had ever done that, which I think, you know, obviously it helps me like to relate to athletes who are having like a first significant injury, where it's like, now if I have a little tweak or something, it's like, for the most part, right, I'm still a human being, but like, I'm like not always very emotional about it. It's like, okay, like I've done it enough times where like I know that this is probably like my timeline to get back to what I want to do, and like this is the other things of how I can adjust it, and I don't generally like freak out too bad.
Yeah.
Where it's like back then, and sure, I mean, this would change if I had a significant injury, right? But like, so having something like that sort of like changes your baseline a little bit.
Definitely.
Where it's like for a lot of people, like even if it is like a significant injury, right? Like there's such a process of like, and for me, it was like, I was guarding that joint so heavily for so long that it was like, there was things that I was dealing with residually from that like I shouldn't have been, because like I was capable of handling more. It was just that like my mind didn't let me go into deep flexion, right? For example. And a big part of that was just like the trauma that was surrounding that, right? So it's like, you can get somebody back to full health and full function, but like they might not be might not be trusting, or they might just be like in a really negative headspace, like as they're going through the rehab process. Like,
right.
Do you like address people like reframing injuries, or like have them like oftentimes like people might be completely healthy, but they're scared to deadlift heavy or something, right? And it's like, how do you address like those sorts of things? That's
a great question, and it is so prevalent. Like, of course, like you just mentioned, I think it comes down to a couple things. Like number one, like I already kind of touched on, like making sure that the training that you are doing, the rehab that you are doing is important to you, like specific in ways that it can be, and then hard, right? Like hard enough that like you're still training at a high level. And then zooming into like a specific movement or activity is like in your brain a little cautious, or you're like, I don't know about this, and then you almost red light it for a little bit. It's finding like graded exposures to whatever activity that is. Yep. And then scaling that up over time. And before you know it, you're going to be throwing 225 on the bar again, right? But like, does it start with picking up a barbell, putting it under a squat rack and doing isometric holds for 15 seconds to get that initial exposure? Maybe. Does it require like a front plank for 30 seconds? Maybe, right? So like finding whatever that entry point is to the activity you're looking to scale back to, and then just exposures along the way. I find that to work really, really well for the mental game. Because the mental game is so important. Yeah,
because you can like talk to somebody and be like, hey, you're fine. Like, we've done all this stuff. Like, you can reason with them all you want.
Yeah.
It's not going to bring their confidence back, probably.
No.
Where it's like them going through it and every week being like, I've done this for the last 22 weeks, and every time I've been successful. I have no reason to believe that this small progression like we've done the last however many weeks won't also be successful.
Yeah, exactly.
Like, I should be able to handle this. And it's almost like, as you build up all that confidence and reps and time, it's like your memory of whatever has happened starts to like fade a little bit.
100%, dude.
Just like, yeah.
You have to heal from injury, but you have to unlearn pain, right? So like unlearn like these boundaries that the brain has created in the mind, right? So which is true. Like the brain will literally it will inhibit certain movements because injury is a data point, pain is a data point in the brain. So we have to combat that with data points that are like, no, like putting the back in this position, holding the knee in a deep flexion angle, like you're good, right? But like finding ways that we can create that feedback loop, that it's a data point for the brain to say, oh, that data point, that's old, that doesn't matter anymore. Like this is the new data point.
Yeah.
Let's keep going forward from there. So
Yeah.
absolutely. Yeah. Graded exposure is big for the mental game, and just making sure training is important to that individual. Like I'm not just giving them some random stuff. And then making it as hard as it can be, as challenging it can be, that they can do well. Like give them wins, give people wins along the way is really important. So yeah, good question.
Sweet, man. Yeah, anything you want to talk about that we haven't covered?
I don't know, man. I'd love to do another one in the future. Yeah, absolutely.
sounds
Maybe
good.
on like a specific topic.
Yeah. Well, there you go. That'll be our call to action. You let Trent know
Nice.
if you want to hear more from...
I wouldn't.
yeah, reach out to him, and if there's follow-up questions, maybe we'll do this again.
Cool. And I appreciate your time. I'm looking forward to this business. So yeah, let's get after it.
Yeah, we're excited.
Cool,
Should be
man.
good. Yeah, thanks.
Cool.
Thanks for listening today. If you're someone who just started listening to the show, I would encourage you to subscribe so you can stay up to date. If you're someone who's been listening for a while, I would encourage you to rate and review the show. And lastly, the best thing that you can do to support our work is also the best thing that you can do for your performance. And that is by hiring one of our coaches. Until next time, stay the course.